Come in.
Hi, I'm Cassie Fuller. I'm a nurse practitioner student. I'm going to be doing your assessment today, if that's okay.
Sure.
Okay. So my patient today came into the doctor, and we're going to explain her symptoms and then move forward. Okay. Can you tell me what's going on today?
I have a burning sensation when I urinate.
Okay. And how long has that been going on?
A few days.
A few days. Has it gotten worse?
Yes.
Okay. So any hesitancy when you go to the bathroom?
No.
No hesitancy? So just burning.
Mhm.
Are you urinating frequently?
Yes.
Okay. Any problems like this in the past?
No.
No. Any problems with any sexually transmitted diseases in the past?
No.
Okay. Anything else that you can tell me about at this time that's bothering you?
My back hurts.
Your back's hurting.
Mhm.
Okay. Any fevers?
I don't think so.
No fevers? Okay. Well, I'll get with the nurse and double check your vitals to see, so we can make sure we fully understand what's going on with you today, okay?
Okay.
All right, so I'm going to do an assessment on you if that's okay, and then we'll go from there.
Okay.
Okay? All right, well, I'm going to start with assessing your lungs, and then I'll listen to your heart, and then we'll see if we can come up with a diagnosis, okay?
Okay.
All right, so I want you to just breathe normal. And as the patient's breathing normally, I am watching for the chest expansion, and I am seeing that the thoracic cage is normal with a normal slope of the ribs. I can see that the patient has no barrel chesting, that she has no lesions, no use of accessory muscles. The patient does have some moles on her skin, so if need be, I would explain these using the ABCD way to assess these. I see that the patient's AP transverse ratio is 1:2, and now I'm going to lay my hands on her and assess her. All right, if I can have you fold your arms across your chest like you're giving yourself a big bear hug. You're gonna feel me touch you, okay? Before I would actually assess this patient, I would have washed my hands. All right, now I want you to say 1-1.
1-1.
Again,
1-1.
again,
1-1.
again,
1-1.
again,
1-1.
again.
1-1.
Okay, and what I'm doing here is I am checking for fremitus in the patient. Next, I'm going to percuss. As I percuss, I would percuss in between the intercostal spaces. And when I do this, I am hearing resonance. All right, I'm going to check for CVA tenderness. You let me know if this hurts, okay?
Okay. Yes. Ow.
Okay, so that's tender back here.
Yes.
Okay. Next, I'm going to auscultate the patient's lungs. And when I auscultate, I will listen in at least 6 sites on the back and 3 sites down. And I'm going to listen with the diaphragm. Big deep breath. Good. And again. Good. And again. Good. And again. Again. And again. And I'm listening to the patient in a side-to-side manner. And I'm listening down her sides of her lungs. And as I listen, I don't hear any crackles, any rhonchi, any wheezing. I hear normal vesicular breath sounds, okay? And I do note that there is some CVA tenderness in this patient. So now I'm going to walk around to the front, and I'm going to just observe the patient. I'm looking again for lesions, rashes. I'm watching her chest expansion. I do not see any use of accessory muscles, no work of breathing on this patient. I do note moles across the front of the patient's chest as well. So now I'm just going to palpate, and as I palpate, I am checking for tenderness, lesions. Any tenderness here?
No.
Okay. And I'm also feeling the patient's skin is warm. She actually feels very hot to the touch, and there's no lesions or masses and no tenderness as well. Next, I'm going to listen in at least 4 lung fields on the front. Deep breath for me. Good. And again. Good. And again. Good. And again. And as I listen to the patient's lungs, she has good vesicular breath sounds with no work of breathing, no wheezing, no rhonchi, and no labored breathing as well. So now I'm going to have you go ahead and lay on this pillow for me. And as the patient lays down, the first thing that I do is I just inspect the patient. So I'm watching the precordium to make sure that there are no pulsations or heaves. At this point, if my patient was not already undressed, I would pull up the shirt so that I can make sure I can visualize her abdomen. Then I will palpate right over the patient's PMI, and I should feel a single impulse. It is at the 5th intercostal space, mid-clavicular line. Next, I will auscultate the apical pulse for a full minute. So as I listen to the patient's PMI, also known as the apical pulse, I can hear that the S1 is louder than the S2. And I get a heart rate of 76 beats a minute as I listen. Next, I will listen to all the different points of her heart. There's 5. The first one that I'm going to listen to is the aortic. So it is the 2nd intercostal space. Right of the sternal border. And I'll listen in the diaphragm. Next, I will move to the pulmonic. And it is 2nd intercostal space, left sternal border. Then I'm going to move down to the Erb's point, 3rd intercostal space, left sternal border. Next, I will listen to the tricuspid. It's the 4th intercostal space, left sternal border. And finally, the mitral, which is the 5th intercostal space, left sternal border. And I do that with the diaphragm. And also, then I'll go back and listen to the bell. With the bell, I'm specifically listening for the lower pitch sounds. And I'm listening for murmurs, gallops, and rubs. So I start with the aortic. Move to the pulmonic, then to the Erb's point, then the tricuspid, and then the mitral. Good. So after I inspect the heart, I will move back to the abdomen. So the first thing I'm going to do is just inspect the abdomen. I'm watching her unlabored breathing, and I'm looking for scars, muscle separation, any rashes, and there are none seen. Next, I'm going to ask the patient to lift her head. And as the patient does that, okay, now relax. As the patient does that, I'm looking for any hernias, and I'm also watching the patient's face to make sure that it does not cause any excessive work for her. Now I'm going to auscultate the 4 quadrants of the abdomen with my diaphragm. And when I do this, I hear active bowel sounds. Then I will turn it over to the bell, and I am listening on the aorta and also the iliac renal arteries. I hear no bruits. Okay, next I'm going to percuss. And when I percuss, I hear tympany, which is normal. And then I'm going to do some light palpation. Any tenderness? Any pain?
No.
Okay, and then I'll palpate a little deeper. Any tenderness? Any pain?
No.
And then I'm going to palpate the liver, which is felt right under the right side of the lungs, or the rib cage. Take a deep breath and exhale. And sometimes you can feel the liver better if the patient does that. And then to palpate the spleen, I put my hand on the back side of her rib cage, and it's right there on the left lower border. Okay, and since I have the patient laying down, I'm going to go ahead and feel her inguinal, for her inguinal lymph nodes. Good, and there's nothing palpable. Okay, so at this point, I have made a pretty good assessment that my patient has a bladder infection. So I would ask her to get up and give me a urine sample so that we can test it. Test her urine to see if there's any white blood cells, leukocytes, bacteria, and so forth, to make sure that we're covering all of our bases. I did find out that the patient's vital signs were normal, with the exception of she had a fever of 101. So this also gives me a good clinical finding that there's an infection going on. So if that's the case, then I would cover her with some antibiotics. I would give the patient good teaching about staying hydrated, drinking plenty of water, emptying her bladder frequently, and that she could take some Tylenol for the pain or ibuprofen, and that she finishes her course of antibiotics so that we can completely get rid of this infection. Thank you very much.